We're very happy to have Allysa here and Nikki here. They are both from Family Voices National. Allysa is the Executive Director of Family Voices National, and they will both introduce themselves a little bit more for everyone so that you can get to know them a little bit. So welcome, Allysa and Nikki. Thank you for being with us.
So I'll stop sharing my screen, and Allysa and Nikki, if you want to take a second to do your slides, now's a good opportunity. Well, I'm going to try to stop.
Great, thank you so much, and thank you for the introduction, Carolyn. We are excited to be here, and so we're going to be talking about, as you navigate a new diagnosis, how do you shift from your role as a parent to really into this advocacy role and really balance the two in meeting the needs of not only your child, but also looking at the needs of the community around you and how you can make a bigger impact within your state and at the national level as well. So before we jump into that, I want to take a chance for Nikki and I to introduce ourselves. So as Carolyn said, I'm Allysa Ware. I'm the Executive Director for Family Voices National. And I'll tell you a bit about Family Voices as we go forward, but a little bit about me. I am the parent of a 20-year-old daughter with an autism spectrum disorder, and her diagnosis kind of hurled me into this world, and I went from accounting to really knee deep in the family engagement world, and ultimately pursued my social work master's and doctorate to really begin to do research around the needs of families and also family engagement. So I am excited to be here. I live just outside of Cleveland in Ohio, so that you kind of understand where I sit in the world. I think that's super important. So I will turn it to Nikki to introduce herself.
Hi, everyone. I'm excited to be here too. Nikki Montgomery. I am the Program and Communications Manager for Family Voices National. And similarly to Allysa, I was, in my world of communications. And then I had my son 11 years ago. He has a rare genetic condition and also has autism. And I grew up as the sibling of someone with a rare genetic condition as well. And so a lot of that has kind of been rooted in my life experience all the way through. But that eventually brought me to Family Voices, and I get to handle a lot of the communications that go out to families across the country and make sure that they are literacy friendly. Much of my involvement with a child with a rare condition has been in the hospital setting, and so I've had a lot of experience advocating with family councils and things like that at the hospital level. So we're really excited today to bring you some ideas about how to expand and grow your own advocacy, because you get kind of thrown into this world that you didn't necessarily ask to be part of this club, and here you are. So we want to make sure you feel welcome in the club and then figure out where you're going next. And so hopefully you'll gain some knowledge and some ideas today as we go through this presentation. But thank you all for having both of us.
All right, Nikki, we can go to the next slide. All right, so talking about Family Voices National, certainly you know about Family Voices of Minnesota and the tremendous work that they're doing in your state. We are the national organization, and we are essentially a network of families and friends of children and youth with special health care needs and disabilities. And at the heart of it, we are promoting partnerships with families. And that's a lot of what we're going to talk about when we talk about advocacy, and how do you partner with providers? How do you partner with policymakers? How do you partner with professionals to really make sure not only are the needs of your child being met, but also the needs of other families within your state are being met as well. Those partnerships, we want to make sure that we're including those of cultural, linguistic, and geographic diversity in all that we do. And ultimately, we want to improve healthcare services and policies for all children, and especially children with special health care needs and disabilities across the country. You can find more about us on our website. We have a wealth of information and resources for families. And we really, at the heart of what we do, provide technical assistance and support and resources out to the 64 organizations across the country that we support that exist in all 50 states, the District of Columbia, 5 territories, and 3 tribal nations. So we span the United States in all kinds of perspectives to make sure that we are connecting families to be able to support each other as they move forward in this journey. Next slide, please. So what are we going to talk about today and do today is in our time together? We're going to focus on kind of making sure that we have a shared understanding of really what should healthcare look like for you. So it should really be focused on patient and family-centered care. And we're going to talk about what that looks like and what you can expect. And then we're going to shift into some conversation around the differences between parenting and advocacy. Talk about some strategies that you can use to be more effective as you advocate. And then how do you really recognize reliable sources of information? And that becomes important as so much is being thrown at you. And all of this information is out there on the World Wide Web and trying to figure out what's valid, what's right, how do I use this? What information do I use to drive my points home within advocacy? So we're going to talk about some of those strategies as well as we go forward. Next slide, please. So first, we're going to start off with, partnering with your child's provider. So here you are, and you've gotten this diagnosis. You now understand that your child's going to have some particular and unique needs that need to be addressed, especially through the healthcare setting. And so what should you expect as you go forward within the healthcare setting from your providers and other clinicians that work with you and your child? Next slide, please. So in thinking about that, we wanted to just start with kind of level setting about what does good quality patient and family-centered care look like? What does that look like when you step into that office? How should you be referred to? What should be happening? Who should be engaging with you? And so just starting off first with understanding, kind of what do we mean by family, and let's all have a shared understanding and context when we talk about family and family-centered care. So, at the heart of it, a family is a constellation of people who come together because of marriage, birth, adoption, or from a desire for mutual support. And so a family could be for you, it could be your extended family members, it could be community members, it could be other people that have a shared interest and desire in moving the health of your child forward and being in community with you in order to get those needs met. Family is also a culture unto itself, as you all know, with different values and unique ways of realizing family members' hopes and dreams. And that's going to become important as we talk about how, you should partner with providers and they should be partnering with you as you go forward. So when you think about patient and family-centered care, it is an approach to the planning, delivery, and evaluation of healthcare that is grounded in mutual beneficial partnerships among healthcare providers. And I want to repeat that again. It's grounded in mutual beneficial partnership. It's not one-sided. It's not just what's best that's going to work for the office staff where your child, sees a doctor. It's also what's beneficial for your family. And it should be a partnership between the healthcare providers, you as a family member, as well as your child or your youth that you are there to address their needs. Next slide, please. So what are the key core concepts? And this is where it gets really important. We're going to get into the weeds of how, really saying, what does it mean to have that mutually beneficial relationship? And so dignity and respect, information sharing, participation, and collaboration are the 4 key parts. And I'm going to dig into that a little bit as we go forward. So what should you expect from your child's provider? As you go in and you're navigating, you're going to, from a different from a family who doesn't have a child with special healthcare needs, your frequency in that doctor's office, how much you're going to be there, how much you're engaged with providers is going to be at a pace and a rate that is very different from families that do not have children with special healthcare needs. And that's really important to remember, and why these concepts are really critical to understand, and for you to be empowered to understand what to expect, because this is going to be a critical relationship that exists across your child's lifespan. So when we talk about dignity and respect, it's really important that your provider listens to you and honor your perspectives and your choices. And you're walking in with your own understanding of your child. You're walking in with your own understanding of what you believe about something, what your family's traditions are, who else should be in the room. Maybe a multi-generational, process is really important for you. I want to be in the room. I want my parents to be in the room, the child's grandparents. That could be something that's really important to you. And having a provider that honors those perspectives and those choices is really important. Okay. You want to incorporate your family's knowledge, values, beliefs, and cultural backgrounds into the planning of care. So as you're thinking about what are my child's needs, how am I going to, get services in the community, the services that I want to tap into, all of your values and belief systems and cultural backgrounds should be something that informs that plan of care for your child. When we get to information sharing, this is really important. And I know this is at the heart of kind of a lot of the work that Nikki does at Family Voices. Communication needs to be clear and concise, making sure that you get information that you understand, that the meaning of it makes sense to you, that you know what the next steps to take as you review this information. And if it's not that, feeling comfortable to be able to ask questions in order to get the clarification that you need. The information that they share should be complete. It should be unbiased information with you and your child that are affirming and useful. Also, it should be timely, complete and accurate information, and that it should be shared to help you effectively participate in your child's care and decision making. Next slide. So participation, this is really, when we get into the thick of it, what does it look like to actually partner with your provider? Not to be, and I often say, to move from being a receiver of healthcare to being a consumer of healthcare, that I am in partnership, that I have agency and say over what I receive and how I receive it to make sure that my child's needs are met. And so when we talk about this, that providers need to partner with you and your family to develop creative, flexible, and responsive plans of care, and encourage and support you and your child to fully participate in care, planning care, and shared decision-making. So decisions, aren't made for you, they're made with you. Plans aren't made for you, they're made with you. You are being a part of that. And as your child is able and capable to do so, they also are a part of what makes sense for them. When we think about collaboration, you want to acknowledge trust as fundamental to family professional partnerships. I was recently on doing an interview about engagement and healthcare and all of those pieces, and someone said, how do we improve, equity and trust within the healthcare system? And I said, it starts at relationships, right? That's at the heart of all of this. How we collaborate, how we build those relationships with the providers and actually partner is going to be based on trust. And when we have that trust, everything else can really flow from there. Being willing to negotiate, right? As I say, what are your heels to die on, right? So I walk in, these are critical pieces that I need for my child. There are some other things that, we can put on the back burner. Maybe I can wait. Maybe those aren't the things I'm going to push for. And that certainly can be the case in healthcare, in your negotiating of the education system, et cetera. But where are you willing to negotiate and where are you not? And understanding what those pieces are. Integrating you and your child into the care team. So you should be a critical part. You are the only permanent members of your care team. Doctors can change, nurses can change, other providers can change, but you and your child are at the center and the heart of it and will always be there, and are the critical, most consistent part of that care team. Value celebrations, challenges, and needs in planning and shared decision-making. And we're going to get into this a little bit with the parenting versus the advocacy in a few minutes, but I really want to pause there and talk about the value of celebrating. We can get, especially when we have a new diagnosis, it's so easy to focus on where are the challenges, what do they need, what are their needs, what am I not getting? But what are those celebrations? What stride did they make? What step did they take? What new skill did they gain? And really being able to celebrate that. Or are they looking forward to a birthday or something like that? And making sure you're celebrating those pieces with your healthcare provider so that they can fully get to know you and your child as you move through this journey. The final piece is to encourage family to family and peer to peer support to navigate care. And as Carolyn said, that's at the heart of what Family Voices of Minnesota does, as well as many other family to family and family to family health information centers and Family Voices affiliate organizations do across the country. Connecting you with other families that have walked the walk. They've been there, they've done this, they've paved the road, they've gone through the challenges, they've had the celebrations. How do you connect with them so that you feel supported and like you're not walking by yourself, because sometimes it can feel lonely and you can feel unsure about what is that next step to take. And so I can't underscore that enough as a critical part of really a thorough and robust patient and family centered care model. Next slide, please. So as you navigate and you really get under your belt, okay, this is what partnership is. This is what, how I'm going to partner with my provider. I've established this relationship with them. I'm beginning to understand my child's diagnosis. I'm beginning to understand what their needs are. How do you begin to balance your role, right? Am I a parent? Am I an advocate? Am I, what am I doing? Because there are tensions between meeting your child's needs and then understanding the broader context with which your child lives in and how you work to advocate for services and needs within your community. And so we're going to get into a little bit of that. So let's start with some language. So what is parenting versus what is advocacy? And teasing this out because sometimes they can be conflated, they can be confused, you can think you're doing both at the same time, and that's not always the case. So when we talk about parenting, we're really talking about a relationship between the parent and caregiver and child that's based on emotions, right? And as it's defined, taking the care of someone in the manner of a parent, right? When we talk about advocacy, it's the act or process of supporting a cause or proposal, the act or process of advocating. So when we talk about advocacy, it's really about knowledge. It's based on understanding needs, strengths, and supports. And it's important to really understand this distinction because when you have to focus on your child, that relationship, that emotional, component, versus when you're really seeking to understand and build knowledge in order to move a system forward and move a process or a policy forward. And so we're going to talk about a little bit when this can, what it looks like and when it can get out of balance a little bit. So next slide, please. So sometimes we can be more of a parent and sometimes we can be more of an advocate. We can lead with emotional, we can lead with the focus around knowledge. So when we talk about, sometimes you're more of a parent and less of an advocate, you can come across as that mama bear or papa bear, or you're overbearing. You're like, oh my gosh, I want this done. I need this done. I'm worried about my child. It's often rooted in fear, right? We see emotion before information. We're not processing all of the information. And we feel like that we're carrying the load without really looking for support. How else can I, garner the support that I need in order to get this need met and gather knowledge and information to do so? On the flip side, we can focus on advocacy far more than parenting, right? We're focused on those health goals. We're focused on those challenges. And we're not really able to enjoy being a parent or a caregiver, right? We're not focused on that emotional connection and piece to our child. We're really centered on what's that next step? What's the next piece I need to do? And the health goals without taking into context the entire child. And so just thinking about this for myself, I definitely think where I landed when I first started, and I'm going to invite Nikki to share, kind of her experience. When I first kind of started in this, I really kind of shifted immediately to an advocate, right? I jumped straight in. All the information I want to know, I'm on the internet, I'm gathering information, I'm reading the research, I'm understanding the literature, I'm focused on her health goals. What's that next thing? And I'm not really enjoying her as my 8-year-old daughter, right? What does she like? What does she need? She's into dolls. She likes all of these pieces. I'm not there because I'm just, what's that next thing? What's the next thing? What's the next thing? How can I get connected to all of these people and information and knowledge and move things forward? And needed to definitely, in retrospect, slow down and say, but I also need to understand and hear from her and what her needs are. And just be her parent instead of always focused on advocating for that next health thing. So I definitely, I tended to err more on that side. And so I want Nikki to kind of share her perspective as she's gone through her journey with her son.
Thank you. My son was born with his condition being very apparent. And so for me, my primary emotion at that point was guilt. And I know some other parents go through this too, but my son was born with the same rare genetic condition that my sister had had. And so I felt very guilty for giving this kid a bum set of genes. And for me, what that looked like was me just plowing in and saying, okay, well, this is all because of me. And so I have to be the one to carry that load. And so for me, it was a balance on the parenting side because that emotion was what was guiding me versus the advocate side where I could have been looking for outside support. So I felt like it was my responsibility to take on the load of his care, to take on the load of the knowledge, all of that, without really looking outside for any support. It was really a difficult time for me to get a hold of those emotions and think about things as an advocate. And I think if I had thought about things as an advocate, I might have said, okay, well, this is what it is. How do I get the right supports in place? I don't have to be the only one managing his care. I don't have to be the one taking on this whole load. So I know it can shift over time, and it has for me, but immediately when my son was born, that was my reaction. And it wasn't beneficial to the process of advocacy in a lot of ways, because I did push out supports that could have actually helped me to get more of my own needs met there too. And I think as we talk through this, part of the role of an advocate is getting supports for everyone, so the whole system works, not just so it works for your child. I've met parents who are willing to travel 3 and 4 hours for therapies and things like that. And what that doesn't do necessarily is create a balance for the whole family. And so when we think about solutions as an advocate, those solutions can't just work for the one child. They actually have to work for the whole system of supports around that child in order to be effective. Or you're going to burn out and things will fall apart, and that can happen too. So it's really important to think about balance. And I think the advocate role is a little more thoughtful and balanced than that kind of emotional leading. And then also, as a parent leading with emotion, you can go all mama bear on them, but mama bear doesn't necessarily build the relationships you need to build and sustain those relationships, because a lot of times these are going to be lifelong things we're dealing with. So I think it's important to think about that balance and even notice in yourself, who's leading in this particular moment. Am I going in mama bear, or am I going in as an advocate? And being able to check ourselves in that moment can be really important. Allysa, I'll hand back to you.
Okay, thank you. Actually, I think the next one is yours.
Got it. Okay. So I could talk to you a little bit about that journey, going from the skills and who you are when you enter this journey to where you might want to be as an advocate. And this has been really exciting to me as an advocate myself, but also seeing that in, like, my sister. As I said, I'm the sibling of someone who grew up with a complex condition and disabilities. And so seeing you go from just who you're born as to someone who's really engaged in the processes of improving healthcare and improving systems for other people. So we're going to kind of walk through this pathway where we start with who you are. Ta-da, here you are. Welcome to Holland, right? And then we get these lived experiences as we go through. We hopefully get engaged with groups and get engaged with our community in new ways that we might not have even expected to have before. And then later, if we are really building our advocacy skills, we can be at the heart of some of the work that's happening in our communities and in our nation to change policy, to change research, and to actually shift the things that are going downstream to our own experience. So this pathway, it's not one that's based on value, right? So it doesn't mean that just because you're at policy level, you don't have advocacy work to do at the personal level, but it does say that there can be a trajectory, there can be a learning path if you want to grow your advocacy skills. And that's really what we want to talk a bit about today. Wherever you are, it's great. You can stay there, you can thrive there, but you can also grow too. So just to talk a little bit more, when we talk about who you are and how you get started, that's really just the basics of what you bring into this as the person you are. Who are you? What experiences do you have? What's your personality like? All of this actually builds into your ability to build your advocacy skills. Do you know how to build relationships with people and manage conflicts? That can be a very important skill in these situations. Sometimes your work skills can actually give you some background that helps you to be an effective advocate, and your education as well. Sometimes your beliefs about what is possible for your child and what's possible for you can really help you to become a better advocate. And then one of the things I like to think about also is how are you attending to your own care and your own mental health, because that is going to affect your way of being an advocate. So when I think about like my own journey, some of those, I didn't necessarily have great conflict management skills at the beginning. I was a middle school teacher, so, you know, that gave me a little bit, but thinking about how to negotiate with people and communicate with people and get people talking around me was something that I had to build as a skill. My son has had lots of specialists since his birth. And so very early on, he had to wear a back brace at 6 weeks old. And then he had respiratory issues. So he had a tracheostomy and a ventilator. And so I had a conflict between these two physicians, the orthopedic doctor saying, keep him in a back brace 24 hours a day. The respiratory doctor is saying, you can't do that because he's not going to be able to expand his lungs. And then the GI doctor is saying, hey, and he's not going to be able to keep any food down if you're squeezing him. So I've got three people telling me different things about his care, and managing that conflict did not go smoothly at first. I mean, it was frustrating. But what I had to learn to do was get them talking to each other in order to give us the best solutions, because none of them were speaking to each other, despite the fact that they were literally across the hall from one another. So that belief, though, that I could actually work with them and get them to collaborate was something that was an important motivator for me in my own journey. And then one of the things that I think continually for myself, self-care, mental health, these things have to be a focus. And I want you to think about the fact that if you have a child with special health care needs, your degree of difficulty in parenting is different than someone who does not have that level of care that's required. So you have to protect yourself. You have to be able to take care of yourself in order to have what it takes to navigate all of the rest of this stuff. And so I think that's key. And if that's not something you've included in your plan so far, wherever you are in your journey, that's one of those things that you have to go back and attend to. But then beyond those basic, who I am and how I show up, we have some lived experience that starts to give us a good foundation for our advocacy. So we build on these skills as we go along. We learn a little bit more about what's out there for us. You hopefully learn from other families, learn from your healthcare providers, what is available to support you. You can find and connect with others, and I think that's super important so you don't feel that isolation that we talked about, because it can feel very lonely and like you're the only one going through this. But there is support. There are people who have had similar experiences. And then finally, you want to start to think about how you communicate with professionals and set goals for your child. And this is something that we don't always think of in terms of medical care and things like that, is setting goals. But you can have a goal for your child. My son was born with respiratory issues at 2 months. He had a tracheostomy and a ventilator. And one of my goals was that I don't want him in the hospital all the time. So I set this goal. I communicated that with the professionals. I don't want him to be in the hospital. What do we have to do to keep him at home? And so I had to learn how to think about what I wanted, what was going to be great for our family system as a goal. And the family system was improved by him not being hospitalized all the time. So that was a goal. And then I'm going to talk through in our next set of information about how you actually create a plan to make that goal happen. But you can do this with the professionals to support you. So you're working with healthcare professionals, maybe therapy professionals, school professionals to support those goals. And this is a possibility. So I want you to be thinking as you go about what goals you might set for your child. So when we think about that, building on the lived experience and setting those goals can be in a lot of different categories. So my first one was physical health. I don't want him hospitalized, but that also has a mental health outcome as well. I'm thinking about my child's social emotional needs. So it can be very easy to get caught up in the medical, right? But social emotional is one of those categories where they have to be regular kids at some point. And how do we bring in some sense of normalcy. One of the things in my household was that we had so much medical equipment that, I mean, I could have run my own ICU. I had all the same stuff the ICU had, but it was very important to me to not have his room feel like a hospital. So just that social emotional side of how does his room make him feel like a regular kid, you know? And how do I connect him to other kids and those kinds of things? And then thinking about like the therapy goals too. So all of these things go into what a well-rounded life can look like for your child. And it's important to think about that when you're thinking about the goals for your child, because that also supports what does the rest of your family life look like? You know, if everything's so medically heavy, then how can we balance out the rest of our family life? So you can set those goals for your child if your child is too young to be thinking about them themselves, but also with your child, with consideration of what your child's needs are. And then also, you know, if you have a child who's able to participate in that, what do you want your life to be like? And that's a really important thing to be considering, is that your child has to be at the center of these decisions that you're making too. Then once you have a goal, you have to find people who are going to support you in it, because it doesn't make sense to carry it all on your shoulders, and you don't have to. So who's going to help you reach these goals? So that could be like your medical professionals, your therapy professionals. It could also be people in your family circle. So who are your friends, your family, who can help support those goals, help you achieve them, other professionals, and then people in your child's school or in your community. And so for me, home nursing was a big support to keeping my child out of the hospital. So that support that we had already in our home, letting those nurses know these are the goals that we have, how do we keep him home, was really important. And they bought into those goals too. And they really helped to support them and keep my son healthy and not in the hospital. So then, like, as you, of course, develop it and find the people who are going to support the goal, you got to share it with them. And that communication is really important. So you do want to communicate what your goal is. Tell them, I want my child to achieve blank by such and such time. You can do that kind of level setting. But then you also have to communicate, what are the barriers? What do you need to get there? And I think this can be a part that feels very vulnerable as a parent, to say, I really want this for my child, but I don't have all of the pieces to get there. And we have to find professionals that we feel safe enough to share that with. But expressing those barriers can also open you up to solutions for those barriers. Sometimes you're like, okay, I don't know, like I'm not sure that our housing is secure right now. I don't feel safe at home. That might be something that you can express to a healthcare provider who can give you support for that. So it is important to be able to express what the barriers are so that you can actually get a need met there. If you have concerns about certain aspects of that goal, it's important to tell the professionals working with you what those concerns are, so that you all have the same understanding of where you want to go. We can't be on a path and nobody knows where we're going, or we're all going in different directions. And so goal setting as a parent is very important, because it can get, well, as an advocate, I'll say, goal setting as an advocate can get you where you want to go, but you have to definitely bring in a coalition to help you get there, because it's not on you all on your own to get there. And then finally, this building on your lived experience, really, what part of it is learning. You can't just stay where you are in your knowledge. And you're going to learn some things just by accident, right? Like you end up learning a whole language of the healthcare system by spending a lot of time with the healthcare system, but also learning with a sense of purpose. What else do I need to know? What are the questions I still have? Who can I ask to get these questions resolved in my own mind? Another piece here that I like to think about a lot is the standard of care. So standard of care is really a legal term, and it's about like, what is the minimum that should be expected for someone who has this condition, right? But it's important for us as parents to know what the standard of care is for our children's condition. That way, you know if the care you're getting actually lives up to what it's supposed to be. So my son and his condition, you know, there are certain tests that are required annually. There are certain things that I should be able to expect from the medical providers in our community to do because of his condition. So knowing that standard of care, I know if I'm being offered the right things. I know if they're going above and beyond what they have to do for him. But that's a key piece for you to just be able to frame, am I getting what I should be getting? What else do I need to be asking for if I'm not? So understanding that particular condition, if you have a condition, if you don't have a diagnosis yet, that can be a little bit harder, but what should they be doing to get me there? And then finally, We're going to talk a bit more later about reliable and evidence-based resources, but you want to make sure that where you're pulling information from is reliable. Make sure evidence-based means that it's been tested by research. And if you're not sure, take what you find to your provider and say, hey, I found this. What do you think about this information that I found? And that can open up a conversation for where you can find better information, for whether this is a reliable source of information. But sharing what you find and what you learn with your provider can help you to learn a little bit more and determine whether those are reliable sources of information as well. And I pulled in a quote here because I think this is something that helps us as we think about growing our advocacy. It's by Dr. Maya Angelou. I learned a long time ago, the wisest thing I can do is be on my own side, be an advocate for myself and others like me. So as we develop these skills and feel really competent in working on behalf of our children, sometimes people will come to you automatically and say, hey, I see you're doing a great job there. I want to know more. And they'll ask you for advice. So you end up being an advocate for others like you, sometimes by accident, but sometimes you really realize you have something to give here. And we do. This lived experience is expertise. And I want you to remember that you are an expert on your child, and then you can become an expert on a larger field of knowledge based on what you've learned with your own situation. So as we build that expertise, it gives us something else to offer to other people and really helps us to grow our own advocacy and help other people to grow theirs as well. So as we move forward, I'm going to talk you through a couple other categories of advocacy, because we've talked about this personal advocacy and getting mastery of what your own child and your own family need. But then beyond that, how do you start to reach out and support others in your community, others in groups that you're a part of? And then how do you go even beyond that to really affect policy and the research that's happening that affects all children? So I want us to talk a little bit through how we go from that personal expertise and building that bridge into bigger expertise. So we'll start with group and community. And some of that as a group advocate or a community advocate means you're going to learn on purpose. And so you're going to be looking at research, you're going to be maybe attending conferences, you're going to look in your local community for resources, but you may look beyond your local community for resources. You may be looking at national sources. And then one of the things I think is important is to notice, I call them gaps and boulders. So the gaps, who's missing? What's not being covered? What am I missing in my child's care that I wish was there? And then the boulders, and this is just a philosophy for me that I believe if I stumble over a boulder in my path, I don't want to leave that there for the people behind me. So how do we notice those boulders in our own path and get them out of the way so that the people coming behind us don't stumble over the same things? And so as you're thinking about growing your advocacy, really that community advocacy is looking around you. What's the stumbling block? What else needs to be here to serve the people in my community effectively? And start to think about those things, because that's going to help you to build your own skill. And then once we go beyond that, as a policy or research advocate, you're being a representative for a larger group of people. And that means you have to not only understand your own situation, you have to understand how that connects to themes and trends and what's happening out there. And then see where other people are getting things you're not getting, or vice versa. Like, what are the disparities here? What are the areas where I'm not getting what I need, or someone else is not getting what they need? And what are the common bonds there? You may have a specific interest or a specific issue that you decide you want to focus in on. For me, health literacy is a big deal to me. I have always found it almost offensive to go into a hospital setting and get a packet of 60 pages of stuff that you need at least 3 degrees to read. And so to me, that's been my area of focus, because I feel like if we are not communicating well with people, we can never get the kind of partnership we need to have. So that's been an area of focus for me, because it builds on my passion, it builds on my education, it builds on my experience. So I can use all of those other parts of myself and my life experience to focus in on an issue that's important to me. And this is something we can all do. We have these unique life experiences we can bring in and focus on an issue that matters to us and to our family. But ultimately, you're looking for a big picture here. As you go into policy and research, it's the big picture. What are the big stumbling blocks? What are the issues with insurance? What are the issues with federal policy? All of these things that trickle down and affect every child. So you have the opportunity here to grow from just looking at your own family to being able to have this kind of broad view of something that affects every family in the country. And I think it's a wonderful opportunity that we have as parents of children with special health care needs to grow our personal experience into something that is valuable to everyone across the country. So I want you to think about that as opportunity too. And you know, in this journey, it can feel like there's a lot of difficulty, but there is a lot of opportunity. There is a lot of joy. There is an opportunity for growth here that we don't always think of. And so I want you to start to kind of frame your mind around that part of things as we go forward. Allysa, do you want to chime in and add anything here before I move forward?
I think the only thing I would just add is, in thinking about, you may wonder, how do I get engaged in this? How do I get involved in this? And we're going to get into a little bit of that as we go forward. But understanding that right there in your community, right here with who is, putting on this 2-day, program for you all, there are opportunities for you to get engaged at the community level, at the group level, talking about policy that matters in your state, talking about research that's happening, right there in your backyard, all of these opportunities. And often that can feel like a world that feels so far away. But this work is happening and you can be connected to it. And that can also, I have found for myself, it really gave me more knowledge and information, a greater sense of purpose and kind of, this is what I'm doing, not just for me, but also for my child. And the outcome of that has also been greater understanding for my child about her own needs and how to advocate. I like I said, I have a daughter with an autism spectrum disorder, which brings its own disparities to it. Girls are delayed in getting diagnosis. African-American children are delayed in getting diagnosis, right? So here she is kind of with this intersectional identity. And so what does that mean for her? And my advocacy became around, as Nikki said, you find this special interest. Mine became around girls with autism in particular, right? Because we go to social groups, we're going to all these things. And she's the only girl in the group. And she looked at me one day and said, "Don't take me back. I'm tired of being the only girl there." Right. And so now I have to think about, wow, she's feeling like an outsider in something that my intention and my purpose, right, was to help her feel inclusion, right, to feel like she's with other children that have a similar diagnosis. But she didn't feel a part and she didn't feel connected. And so that became where, how can I build resources and programs and information for other girls that are on the autism spectrum. So I think that really, you can't do everything. And I think that's the part that we should really, highlight here. You can't be everything and fix everything, right? So where is your talents and knowledge and interest and passions to drive that piece of the puzzle forward, right? So yeah, I'll end it there, but thank you for the opportunity.
Thanks. Okay, so I'm going to go into a little bit more of this group and community, the advocacy here. So it's really going beyond that personal experience that you've had where you've become the expert on your child. For me, one of the big markers of being an expert on my child was how fast can I change a trach? So I was able to finally change a trach in like 20 seconds. And that felt amazing to me. It did. But then what do I do with this knowledge, right? Because it doesn't apply everywhere. I can't use this usually in my everyday work. But learning how to apply these skills and expertise into a different domain. So some of the things that I did initially, and a lot of you have probably done these, is I joined online communities. I joined some local support groups. I connected with other organizations that were specific to my son's condition. So he has a rare condition under the muscular dystrophy umbrella. So I joined Muscular Dystrophy Association. That was important to me to be connected with an organization that knew about his condition, that could offer clinical services and advice and things like that. One of the other things that for my own growth was really helpful was a play group. And it didn't, like, it was something I thought of as being for my child. I want him to connect with other kids. He was a year old. Okay, let's join a play group. But it actually was more beneficial for me because, I mean, frankly, 1-year-olds don't care what's happening that much. He didn't care about the play group, but it mattered to me because I met other parents who were in different stages of their own journeys, who had different levels of engagement, and it made me feel less isolated. So that play group was actually pivotal in turning me into a hospital advocate because I got introduced to parents who were involved in hospital advocacy. Another thing you can do at this point in your journey is just share your story. So talking about what I've gone through, what the barriers were in those boulders we talked about, what the gaps are that you see, those organizations, including Family Voices of Minnesota, are good places for you to share your story and share what the barriers are for you, because these are groups that are already working on solutions. So this part of community and group advocacy not only gets you connected to other families, it gets you sharing your story in a way that can start to build solutions. So it's not saying you have to be the one to go out and do the research on this, but you can be contributing to the storytelling that happens at your state level and the storytelling that happens to gather public support for the issues that matter to you. So it's not just having that personal story, but it's learning how to share it with other people so you can get them to understand what those barriers are. And then some of the skills you need here. So it's not just like you pop in and know how to do this stuff. You do actually have to build skills at every one of these levels. And one of them is to broaden your circle, right? Like you have to learn from other people's experiences. So you have to be willing to listen and learn from other people, build those connections. And for me, this can be tough. Like, you know, if you're not great at if you're not gregarious and outgoing, sometimes this part can feel like the tough part, right? So for me, that was tough because I tend to be a bit shy. So I don't always want to pop in and say, hey, everyone, here I am. But I had to build the skill of connecting with other people and learning to talk to other people and share stories. One of the things I think is really helpful as you're going into group and community advocacy is really not judging other people's stories, because we all come in with a set of circumstances that you may not fully understand, but listening so that you can understand and learn what those gaps are, so that you can help be an advocate for situations that even don't look just like yours. And I think here, this is really important to look around the table. Who's not here? Which voices are we not hearing enough from? Because that means you don't have a complete story if you don't have the groups of people who are most affected by a problem sitting around the table with you. So getting that wider circle and being able to kind of look around and observe what the scene looks like is really important here. So you can see what's happening in your community and then be able to contribute your story to what's happening in your community. And again, I go back to learning on purpose, that there really is a goal here to expand what your knowledge is. And so some of it's like subscribing to a blog or reading articles, what matters to you and learning more about those topics, finding new information that maybe you didn't know about before. So there can be a parenting magazine and newsletters and things like that that connect you to more information. Research articles are great. Sometimes they're not the easiest to follow and read, but if you find something of a topic that's important to you, take that to your child's providers. Let's talk about this together. Help me learn more. And so this offers a good opportunity for collaboration too, where you take information you find and run that through your providers and professionals that work with your child, so you can be sharing the knowledge you're gaining with them. Conferences and seminars, you're here today, so that's a great sign. You are attending and looking for more information. And then across your state, across your local community, there are going to be sources of information for you that can help you grow, help you understand more about what's happening at the state level. So you can be thinking not just, again, about your own situation, but how your own situation really connects to the stories of others. What do you have in common? What are the things that are different that show you where gaps are and where better services and supports are needed? So getting that group advocacy view, I think of it like as you're going up in a plane, you know, you're sitting on the ground level. This is your personal story. You know what's happening. As you get up a little bit and the cars start looking like ants underneath you, you're getting a broader view of what's happening. And then eventually you'll be, you know, above the clouds here in this 30,000-foot view. So it's taking a broader and broader view of what's happening in your life and how it connects to the wider world of what's happening. And then I'm going to go into, before I get to policy and research advocacy, Allysa, do you want to add anything here about the group and community advocacy? No, okay, all right. So as we go to that group and community advocacy, we talked about the broader view, but policy and research is kind of going up another level here, because there are policies that affect how those groups operate. There are policies that are at the federal level that affect how your state level operates. So thinking about policy and research, this is a broader view of work that's being done to affect all children. And here, as an advocate, your role is really to bring forward the voices of all those stories you've gathered, right? So the stories you hear at the statewide level and the local level and the community level, you get to represent those voices to a broader audience who may not understand what our lives are like as parents of children with special health care needs. So you get to be that voice on behalf of the other voices. You're not just speaking for you, you're speaking for all these other stories that connect to other people's stories. Here, it is really important to understand what the disparities are, because your story may not be the most representative story. So what else is out there? What other experiences are people having that are different than yours that can build into this bigger storytelling? I think a value here is to actually learn how government and policy making work. I don't know about you, but I took government in like 10th grade. It's been a long time since I've been in 10th grade. So recognizing how something goes from an idea to a bill, to a law, to policy, is something that I had to relearn in this journey, because it's not something I just automatically remembered. You know, you got your representatives in your city, you've got your representatives at the statewide level. So all of these different levels of policy makers and decision makers, it was important to remember that again. In my own story, my son and I go for walks through the neighborhood. He uses a wheelchair. So when we encounter a sidewalk that's not accessible, I'm teaching him, okay, who do we contact about this? Because that's not the same, that's not my statewide legislator. That's my city council person. And so thinking about these different levels of government and decision making, it's just an important reminder, because most of us don't have that as part of our daily work. But then you also want to know what work is currently happening, both locally and at your state and national levels. So there's a big push nationally about mental health. Autism is a hot topic nationally. Knowing how your story fits into those bigger topics can also tell you where to go for support and who's working on certain initiatives. So thinking about that work and what's happening, what's trending, what the conversations are about, that gets much more important at this policy and research advocacy level. And again, you can develop an area of interest for yourself. What's important to you? How does that connect with what's important across the nation? And how does that then build into the ability to get support for the ideas and the things you want to focus on? So once again, you do have a set of skills to work on under this topic. And so those skills are first knowing the issues, right? What does it take right now to get in here and improve the lives of others? Who do you need to push on? This is about button pushing and levers and all of those things. So who are the decision makers here, and what legislation is currently happening? That can be something like just subscribing to a listserv about government issues that are happening in your state, but learning about the legislation that's in progress right now that affects families like yours, and paying a lot of attention to current events. So, and one of the things I want to say to you right now, because I know this sounds like a lot, is that it doesn't have to happen all at once. But as you grow, as you feel a level of mastery of the previous thing you were working on, you can add a new skill here. You can learn a little bit more here, and then start to reach out and really make contact with the people making those decisions, because those people should want to hear from families like ours. They have to hear from families like ours to really understand what our lives are like. So who makes the decisions? Which organizations are already working on these initiatives? All of that together can make you a better advocate and build on your own skills at advocating on policy issues and research issues, because you then will know what that broader, 30,000 foot scene looks like. And across all of this, really, it's about the relationships you build. So this is really key. And this goes back even to the parent and advocate conversation. that Mama Bear doesn't necessarily work very well at the policy level. Mama Bears might work sometimes at the personal level, but building relationships means recognizing that I'm going to have to engage with these people, that we have to have respectful and cooperative conversations, that I have to be honest about what my experience is too. Sitting at a table with people who are decision makers and saying, yeah, everything's great when it's not great, also doesn't move forward the things that we need as a community. So those relationships, being honest and respectful and cooperative as you move through each of these phases, is really important, and it builds your skill level. It also builds your reputation as an advocate in your own community. Allysa, do you want to add? Yep.
Yeah, I'll just add to this. And I think I said this in part of my presentation earlier was, at the heart of it is relationships. And I think the key thing here that was such a lesson for me in my own journey was this idea of positions and interests, right? So everybody comes into a situation with, this is my position and these are my interests. You walk into every situation with that. Like I said, what are your hill to die on issues, and what are your things that are like, yeah, these would be great to have, but I'm okay. Everybody's coming to the table with that. And so at the heart of this, it's understanding other people's positions and what their interests are, where are their shared interests, and where are their opportunities for compromise, conversation, cooperation, collaboration. When we get to that, so that we don't walk in automatically going, they just don't want to give my child what they want. They just don't want me to have, they're not taking my position and my interest into consideration. Sometimes that is the case, and I'm not gonna cloud over that, right? Sometimes that's your end result. But a lot of times it's that we really have to hit pause and take the time to say, this is what's important to me, and this is what's important to you. How can we both get our positions and our interests met while absolutely meeting the needs of my child or other children, if especially if you're in an advocacy role. I can't say this enough, and it's something that personally I carry into my work and in the health field, my work when my child was going through schools and IEPs and all of those things. I understand that everybody has somebody to answer to. Everybody has a focus that they want to take, but how do we take all of that into consideration to meet the needs of the child that's in front of us? And so and that's going to help you foster relationships that will last throughout your child's life. There are people that have been in my child's life since she was 7 and 8 and just getting diagnosed to today, and she's 20. And because we took the time to say we do come from different worlds and we do have different perspectives, but our overarching goal is for each of us to meet her needs, and how do we work together to do that? And that's going to be necessary as you go through each of these levels. When you sit in groups where people are going to have different interests in you and different belief systems and knowledge and experiences, and just taking the time to listen and understand what those positions and interests are, so that you can have empathy and compassion for where they are, while also understanding and advocating for your own needs and interests. So yeah, I just really wanted to share that because I think this is at the heart of all of this.
Thank you. All right, so I want to go into a little bit more about evaluating information. We talked about this briefly earlier, but as you become an expert, people expect you to have information that's valid, and also you have to then know where to find valid information. And I think this is one of those key pieces. So I've got here just a contrast between what is unreliable and reliable in terms of the information that you might receive. So unreliable, I have personal blogs, online groups, and social media. And I'm giving the caveat here that unreliable information doesn't always mean it's bad. It just means that it's not always reliably good. So it's more likely to be information that's based on one person's situation and not necessarily applicable to you. One of the things that I actually got into after my child got his diagnosis was studying critical thinking of parents. And the reason this came about was he had a trach, and I was in some parenting trach groups. And I would go into these groups, and the parents are like, hey, my child's having a major issue breathing. What do you guys think I should do? And it was like, please talk to your doctor. Don't talk to these people. And it's not that they don't have valuable information for you, maybe, but if you want reliable information from a source that's going to be particular to the needs of your child, you have to search for that in a place where you're going to find more reliable information. So I don't want to say that people's lived experience is unimportant. It is important, but is it always going to be reliable for your child? Maybe not. So this is where you want to consult some of these more reliable information sources. So research articles tend to be more reliable, although the caveat is that all research is not all inclusive, and that's something we want to change on a national level. Information from your medical professional or an organization, those tend to be more reliable sources. And then your Family Voices affiliate organization can also provide you with reliable information that has been tested, that's been run through other sources. And so those are some of the other places. I do, as we said, get information from all of these sources, but what I rely upon to make decisions is going to be from one of those reliable information sources. So you can join the groups, you can be part of social media and follow different things, but that means that when you're making your decisions, you want to make sure those decisions are made with reliable information. And again, your providers are a good source for vetting information that you find. You may find something that sounds great, but talk to your provider about that information too. So it's very important for us as we become a source of information to make sure we're finding and using good information, so we also are reliable in what we tell other people and what we contribute. And finally, when we talk about the family affiliate organizations, I want to make sure that you know that there is a whole network. So there are family-to-family health information centers in every state, in 5 territories, and in 3 tribal nations. And there are affiliate organizations across the state that are family-led organizations with people who have this life experience like you are gaining right now. And they're all staffed by skilled family members who know how to use that life experience and share that with you in a way that can provide support that you need. So you're in the right place right now, and continue to sit in these spaces where there are other families who have that expertise and can share it with you. We also work with providers to help them be a better place to land for you as a family. So I think it's important to remember that there are networks of people out here who are building these skills and ready to help you build them too. So I want you to think a little bit about where you are right now, what level you might be at, and then where you want to go. Is your goal right now to be a better personal advocate? I want to gain skills and expertise to just be a better advocate for my own child right now. Or are you at a point where you're saying, I feel like I've got that, I want to move into group and community advocacy? Or do you feel like you've got that and you want to move into policy and research? I would say to you that it's building a path, that it's hard to participate as a policy and research expert if you haven't mastered that personal advocacy yet. And so each one does build on the other, but you can build on them and continue to grow. So if your goal right now is to be a better personal advocate, there's a process called care mapping, and you may be familiar with it. When you get these slides, that little star is actually a link you can click, and it goes to a whole set of information about care mapping, where you're looking at the global view of your child. My child is in the center. What are the supports that I need to make their care happen more effectively? So that's one step you can take at the personal level to just grow your skills as an advocate, is looking around to see the supports you need at that level to make your child's care better. And who do you need to bring into these conversations to get support on those goals you're setting? Who can you go to check on information you're finding? That personal care map that you're creating helps you to be an advocate at that level. It also is a way that you can go forward in setting goals for your child and setting goals with your child. And finally, we talked about at that personal level, learning to share your story. So if you haven't done any of these 3 things at the personal level, these are great places to start start for you to build that out as a great way to round out your skills as a personal advocate for your own child. If you feel like you've mastered all of this and you feel like you do want to go to a different level of advocacy, that group and community advocacy level has its own steps. And some of it is just learning about what's happening in your community. Do you know what's going on around you beyond your personal situation? Have you met other families? It's again, very isolating as a personal advocate sometimes. So meeting other families is a great way to start hearing more stories, to start understanding what things are affecting other families around you. And then joining different kinds of groups. So it could be an advisory council for your local children's hospital. It could be some other family group or advisory group. Those things help you to understand those bigger stories, the stories from other people, and see what initiatives are happening in your local world that will help you to be a better decision maker and advocate. And then finally, if you feel like you've got all of those, you may want to be looking at policy and research advocacy. So here's where you get to dive deep with a personal interest, an issue that you really care about and want to learn more about, and see who's doing what about these issues in your community and beyond. You may want to get involved more deeply with organizations that serve you. So, if you're involved at an organizational level, then how do you want to build on that? Do you want to become part of a leadership team? Do you want to be a president of one of these family councils? Those are different things that you can do to build your skills and start to participate in what's happening in policy and research in your community. And I want to focus on the fact here that advocacy matters, that your role here is not just fluff. You actually do make change. So even at the personal level. So at the personal level, when you're, building out what your child's care goals are, you actually end up getting more interactions. You pull out of that isolation. You get more supports that you need in your personal journey. That can reduce your stress level. It can support your mental health. And then it can help you be connected to more services and supports that you need in your own life and in your child's own situation. So as a personal advocate, you actually get positive outcomes for yourself and for your child. When you go to that community and group advocacy, your work actually can improve services for other families and improve the way they experience a particular service, organization, hospital, all of those things. It can help other systems understand how to serve people better. So if you're advocating at a hospital, that hospital can learn to understand families' needs better because of your participation. And it can also improve the way they respond to family concerns. I remember having a health issue and a safety issue that happened with my son. And the walls I was running into, I was able to actually advocate at the hospital level to improve the way they communicate with families all through the hospital and respond to family concerns. So organizations are learning from you how to be better and how to serve families better. And then when we get to that research level, you get to provide your perspective to these bigger decision-making bodies and share what our experiences are. And if you think about like your state legislators, maybe they don't have a child with special health care needs in their family. They may have no background understanding, and your voice gets to be the one that helps them shape policies that help families like ours. So it's really important at this level that you're sharing an experience that is shaping systems and shaping policies to people who may not have any understanding or background on that. It can also give a more complete view to these people about how policy is going to affect people's lives like ours. And hopefully all of this together creates a path for health equity for children like our own. So we know that children with special health care needs often do not receive the services they need to receive and deliver it in a way that is culturally competent and understanding of all of their needs. And what we can do is build these systems more effectively and create more equitable health care and more equitable policies and systems for all of us. So this is a great opportunity in your role as an advocate because you can really create change that goes across larger systems. Allysa, would you like to add anything here?
Yeah, I'll just expand on this policy and research piece and dig in on research just a little bit. I think that not only at the policy level are you actually helping to create policies that affect people's lives, but also research. A lot of the research that's done and the questions that are asked are based on somebody sitting around and saying, what do we need to be thinking about and problems we need to solve? Research that is meaningful to you and your community and your state and even at the national level for children, your child and children like your children, it can't happen without your input and your voice in the conversation. How are you involved in help shaping those questions? What should researchers be looking about? What do we need to better understand? How do you, and then as Nikki was talking about, when we even pull research articles, how is that information then communicated out so that it becomes accessible to families? That there is a accompanying blog, for example, or information that's shared out so that communities begin to have access to this information and it's not stuck in academia or stuck in medical centers or research centers. And so I just want to hone in on that. We can talk about a lot with policy and going to your state legislators, but there's a lot of money that's put into research and there's a lot of opportunity to impact what is it that we research, because what we research then guides where we put our dollars. It guides the interventions that are put in place. And if money and questions and research aren't being asked and done, then we can't move a particular initiative or intervention forward. This also becomes really important when we talk about, as Nikki said, pathways to health equity. We actually cannot build interventions that are effective for different populations if we don't see everyone involved and engaged in the policy and research realm and process. So just being really thoughtful about that and thinking about how you can get involved, and certainly at Family Voices, and Carolyn has certainly been involved as well with the research networks that we partner with to bring those family voices into the conversation to help shape the entire research process, so that we can actually identify and research and understand effective solutions to needs that you have for you and your child in your community.
Thank you. So I also, before we finish, would not want to miss the fact that children can also be involved in advocacy. And as a parent, one of our roles, I think, and as an advocate, one of our roles should be preparing that next generation to advocate for themselves, right? How can they best use their voices? And how can they best stand up for themselves and their needs? And this is a skill they're going to need throughout their lives. If you have a child with special health care needs, you know that their adulthood and their childhood, they're going to have a voice. And you can start to build that very early, whether it's just them stating their preferences, stating their likes and dislikes in whatever way they communicate. So they can understand the goals, they can help set the goals. They can be part of the team, and so they should be involved in speaking up about their care. If you have providers who are doing that patient and family-centered care well, they should be talking to your child or trying to understand what your child's needs are in whatever way your child communicates them. Your kids can learn more about their own needs, learn about their care plans, learn about the processes that keep them healthy and well. They can ask questions about that care, and they can start to speak up for their own needs, not just in the healthcare setting, but at school. They can learn to be good advocates for themselves. And so it's important that we, as we're building these skills as parents, also instill these skills in our children. You don't want your child to be 18 and then ta-da, you're in the adult world and you have to suddenly develop a set of skills. We should be helping them develop their voice along the way. And youth participating in advocacy efforts can be really powerful voices for their own experiences, because it's not just about our experiences as parents, right? They're living a life and having their own experiences and perspectives as well. And so, there can be some tension between youth advocates and parent advocates at a certain age, because they want to speak for themselves, and they should. To whatever degree they are able, they should be able to speak up for their own needs. And if we're doing our jobs well, we are priming and preparing them to do that. So, my son is definitely, he loves to speak up for the quality of his care. He will give me a play-by-play of how his nursing care went and who did what wrong if he wants to, but that's okay. Like, I want him to feel safe to state, this is what was done well. This is what my expectation is. He should know what good care looks like for himself and what that feels like, because over the course of his lifespan, he's going to need to be evaluating that and advocating for good care. So it's just important for us to remember that our role doesn't stop with building our own skills. We can take our children through every one of those same steps of personal, community, and policy advocacy, and they can be very powerful participants as well. And so I like this little quote: if you think you're too small to make a difference, you haven't spent the night with a mosquito. We all have the power to change systems. We have the power not only to change our own lives, but we can change a whole system if we become effective advocates. And I think the power here is, we shouldn't underestimate that. We often start off feeling very helpless, right? We got into this, we're in a situation we didn't plan for necessarily. We may not have known all of the things that were going to come out at us, but I think many of us find a sense of purpose in this journey. And I think that's so important, because you can find that, you can identify that, and you can really make a difference as an advocate in your role. So I want to encourage you that if you're not feeling that level of power yet, you can get there, that as you master these skills in your personal advocacy, you can be a powerful voice in our larger community. And it just takes a few steps and a little bit of growing and learning, but you can be there and you have the supports around you to get there. So I want to encourage you in that. And I will pass it back to Allysa. We have a little bit of time for questions and discussion, so I'd love to hear from you what your ideas are. And I think the chat is being monitored and moderated too.
Yeah, thank you, Nikki. And again, we are so grateful to be here. You know, a few discussion questions that we have just as prompts to the conversation, but certainly any questions you have that have come up for you as we've presented, we are open to answer as well. You know, we want you to really think about, where are you in your advocacy right now? Do you feel like you're at the personal level of the group and community or policy and research? Where do you want to go next? And what are your next steps to get there? And you don't have to answer these questions live with us today, or you can, but these are things that we want you to think about as you walk away from this presentation. What is that immediate next step? Where do I go? How can I get engaged? Whether it's, no matter which level it's at, and there's no wrong level of where you are. It's just taking that next step that's right for you. So I want to open it up for any questions or comments about these questions. What other questions or comments?
Folks should feel free to raise their hand, but if you prefer to have me read your question out, you can put it in the chat too. I'm happy to do that. So we have someone who chatted, I'm exhausted. It's like one step forward, two steps back. That self-care is so very important. I appreciate your message of that well-rounded and distinction family advocate expert role.
I'd like to add here that a lot of the advice I got about self-care at the beginning was, go get your nails done, get a massage. That sounds cute. When am I doing this? You know, like, what's the practicality of this advice? But the other part of self-care is very basic. Are you getting your general physical every year? Are you having your mammograms if you're old enough to have a mammogram? Taking care of your health is very important to you being able to help take care of someone else's. So it, to me, was not about the fluff of manicures. I don't do manicures. For me, it was more about making sure I was looking at my own health as part of the system that supports my child. Because what happens if we have a caregiver go down in our family is a huge deal. And so to me, thinking about that from a very basic level, how do I make sure my stress level on a day-to-day is managed? How do I make sure I'm getting enough sleep? How do I make sure I have a break so I'm not, you know, super impatient and crabby with everybody else in my system? Those are the kinds of self-care that mattered to me. And that may mean that you have a lot of different ways to support that. So it's not just the nails. Do you have a mental health professional? Do you have time for a 5-minute break today? Can you take a shower today? All of these different things may just be the supports you need. It's not about going out for a girls' night and all of that. It's about, what are the supports today that are going to get me through today? And so for myself, I developed, and really a lot of this I learned during COVID because of the stress of having a virus out there that was respiratory with a child who's respiratory compromised. It was extraordinarily stressful. So I had a list of 30 things I could do in the course of a day to de-stress myself. Have a hot cup of tea, lay on the couch for five minutes, do a little bit of yoga, go outside and stretch. But I had a list of 30 items, and some days I could make it through the day doing 3 of them, and some days I needed 11 of them. But having a cache of things I could do to bring my own stress level down was really important to making the system work for my child. So I want you to think of that not as frivolous stuff, but as how do I manage myself as a caregiver so I can be at my best.
Well said.
Any other questions or comments?
So I'll make a comment, that when my daughter was first diagnosed, which was when I was also a new mom and she was a baby, this being able to see parents who were advocates looking comfortable while I was like really, really uncomfortable was such a gift. So I just want to say thank you for giving us this gift. Kristen is highlighting in the chat what you said about child participation and advocacy. I love that and how that can start so early.
And I'll add to that. So my daughter had an IEP in school, and of course they're focused on her reading, her this, her that, and I said, I want in her IEP to have self-advocacy goals. This is really important for me. It's more important actually to me than like moving her reading level along or moving. She has to be able to speak up for what her needs are. And I really pushed on the school this was my hill to die on, right? When I talk about positions and interest and what are those things, it was non-negotiable because that to me is more important. And this when we talk about thinking about the social emotional, thinking about all the different aspects, that if she can go out in this world and express what she needs and advocate for herself, she can get a lot of places. And it may not be all the things that everybody thinks is where she should go, but she can get where she wants when she can advocate for her needs. And I think that you can build that in the healthcare setting, you can build that in the education setting. And today, she does all the advocating, even with me. No, mom, back up. That's not what I need. So I might have done too well, but it really is something to keep in mind, because we are so used to being their voice and making sure that they have what they need, but helping them to be able to express that in their own ways and their own ability is really powerful as they move through life. Anything else? We have a few more minutes before the end of our session. Well, we thank you for your time. We thank you for having us here. We're excited for the work that's happening here in Minnesota that Carolyn and her team are doing at Family Voices of Minnesota. We are always excited to partner and connect with them. There certainly are also, we're always recruiting at the national level for opportunities to get engaged in all of those levels that we talk about in systems change and initiatives. So, be in contact with Carolyn about what those opportunities might look like. Please, reach out if there's any supports or things that you need from, Family Voices National, but you all are certainly in excellent hands at Family Voices of Minnesota. So thank you.